Hello there. Are you here for an appointment? Okay. Please have a seat on the examination chair facing this way. Thank you. And to double check, what is your name and patient ID? Okay, perfect. And then the numbers on the ID. Okay, great, thank you. So, you are here today for the very detailed face examination, correct? Yeah. A nurse recommended that you see a professional for your face. So, my name is Dr. C. And as I see everything, I am an eye and facial muscle specialist. Pleasure to meet you. Truly. And I do see that one side of your face might be missing some symmetry. Perfect time for a face exam. So, what we're going to be checking for is symmetry on the face, to see how you react to pressure points and sensitivity on your nerves, muscle similarity between the two sides of your face, a quick sound examination, and facial reflexes. Okay, great. Now, do you experience any pain with your face at all? Okay. My hands are clean. May I just touch around your face, particularly your eyes? Thank you. So, I'm just going to just press around the face. And because this side of your face has some muscular problems, drooping of the eye, drooping of the chin, and side of mouth, I have a feeling I know what this could be. So, have you been in any injuries lately? Okay. And where I am touching your face, do you feel any sensitivity or pain? Okay, you do on this side. And going back to just gently touch the side of the face. Does that feel uncomfortable? Yes. Does it feel like this side? No. Okay. I'm going to use a measuring tape first to assess the differences between both sides. So, just relax, okay? Are you feeling okay for now? Okay, good. So, just going to quickly assess the differences between the eye proportions. Have you had any stress recently? And have you been sick in the past month or two? Okay, so muscular dystrophy is caused by a lot of things. Muscle problems can happen from injury, trauma, stress, diseases that you've had within your family, or viral diseases such as Bell's palsy. And that's what my biggest concern for us right now is Bell's palsy, as it is a viral problem. And looking at the distance of the drooping on your face, my thoughts are pointing to that. I'm going to focus the exam then on testing for that for now. Okay. Proportion-wise, the face is just a bit off. Kind of like the eyes are just drooping a bit, along with the muscles. Very similar to what happens if a patient who experiences a stroke could lose partial sensitivity or muscular proportion to the face. I'm going to put a glove on now because I'm going to be focusing in on muscle therapy. Now, getting my glasses on, I'm going to be taking a very good look at your eyes, okay? I have a pen light here. I'm just going to ask you a series of questions, okay? Thank you. So, if I get too close to your face, please try your best to keep focus at my fingertips. So, I'm just going to shine the light at you. If it causes you any headaches, let me know. So, I'm going to just poke. Just poke. Poking around. Poke. Okay. Poke. You seem to be lacking flinching on the side that has the muscle problem. I'm now going to pull onto the bottom of your eye. Keep focus and look at me, okay? Thank you. I'm going to focus on this side first. So just going to pull. Keep looking at my eyes, okay? Okay. Okay. Proportion-wise, onto the other eye now. So, I'm going to pull down and just take a quick look at this eye. If this causes you a headache, particularly on this eye, let me know and I will perform another examination. Okay. Okay. There seems to be a lot of inflammation in that area. Now, I'm going to ask you, have you experienced any drooling or inability to keep your mouth closed due to the muscular problems? Okay. I'm just going to take a peek and look inside your mouth, okay? Really quick. Just looking around here. Okay. I do see that there could be, again, inflammation, which could indicate a viral change. I'm now going to be doing something called funny enough, it is called the sharp test. If you feel it around your face, just say yes. So, an example, I will touch your face and you say yes if you can feel it, okay? Thank you. I'm going to be watching your muscles flinch as I do so. So, bringing the light out again. answers on the muscular side, as I would assume. Next, this is the soft test. This is a very soft brush. I'm just going to gently brush it onto your face and tell me if you can feel the brush. So again, watching the muscles reflex, so. Okay. Okay, now a bit more detailed, so. Okay. 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 Thank you for your responses. I do see that sensitivity seems to be an issue, particularly with this side of the face. Have you been experiencing any dryness with the eye or mouth that has been affected? Okay. Next, I'm actually going to take a sample of your saliva, if you would allow me to. I'm just going to go cheek and take a cheek test. So just excuse me for one moment while I just take a sample. Okay, I'm going to send this into the lab for a thorough analysis. And prior to this, have you had any viral illnesses that could have affected your immune system? Okay. I am now going to do a quick sound test as the muscles could have been affected. I'm going to be making random sounds in different directions. Let me know if you can hear it, and if it's on one side or the other, lift a hand up for each side. Okay? Thank you. So. Both sides cracked. every time I point at an area, I want you to try to clench or open or flex that area. So, yes, so for the eyes, you could open them, you could close them, you can clench the eyes. So, just going to poke. Good job. Okay. 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 Next, I'm going to ask you to close this eye as I'm more focused on the more affected eye. I'm going to ask you to read the Snellen's chart. So, pointing my flashlight. Do you have the ability to read this first letter? Okay. And what is it? Okay, in E. Now, what about these two right below? Okay, and F and a what? A B. Good job. Now, what about below there? Inability to. Okay. Could you switch eyes really quick? Yes, cover this one now. Now, what's the lowest line you think you could read? Okay. This one down here, or the one right below it? The one right below that. Could you read the letters up to me? Yes. D, E, F, B, O, D, E, and C. Good job. Do you have glasses that would affect the way that your eyes function? Or prescription different from either eye? No. Okay. That leads me to guess that this could potentially be a viral problem or a muscular problem. I'm going to continue with the face examination now. I'm going to be doing something called roller therapy, and it is not brand new to these studies, but it is thought that the more that you could affect the area, such as massaging the non-working muscles, could potentially get the muscles to work again. So I have a little bit of a steroid anti-inflammation balm here, and what I'm going to do is apply it to the areas where you appear to be affected. Then we're going to do a roller treatment to hopefully get the muscles to be working again. So, getting a little this process, have you felt any, perhaps a headache, or more sensitivity, or less ability to touch and feel your face? You're good. So, last but not least, I'm going to poke around your face and you let me know when you start feeling your skin again and when you are unable. So if you are unable to feel a part, just say nope, nope, nope until you actually can feel the sensitivity of the pressure of the gloves on your face. So just going to. Okay. Good. 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 Okay. Good. Okay. Good. Okay. Okay. I have completed the assessment, and I do think that there is some muscular problems going on. I'm going to send that to the lab to see what kind of thing we could find, and if it is not it, I'm still going to send you in for a CT scan and an MRI, just double check and make sure that there's something, that it's just a virus or something like this and not something that could be going on, perhaps muscular problems or in your brain or something being affected. Okay? Okay. I just want you to feel safe. So, again, thanks for coming on by. I hope you feel okay, and if you start feeling more parts of your face having less of an ability to have sensation, please come back and let us know immediately, okay? Perfect. Thank you so much for hanging around. I know it's a bit stressful, so I hope I could at least make you feel a bit safe. Till the next time, we'll send your results as soon as we get information